Hi, I'm Chong. I'm a plastic surgeon at Puat Hospital. First and foremost, thank you everyone for taking the time off this Saturday morning to be here. We are indeed very grateful. I'm also thankful to Dr. Jerry, the organizers, and all the other speakers for giving such great talks. So now after Jerry's fantastic talk about breast cancer, I'd like to switch gears a bit and talk about what happens if you go for mastectomy or breast cancer surgery. What can you do about it? Can you restore what cancer has taken away from us? Okay, so just bear with me and I'll walk you through what breast reconstruction is about. So most of us, when we talk about plastic surgery, you actually relate it with mostly cosmetic procedures. And that is the truth. It dominates the most common procedures done in plastic surgery. But there's an increasing prevalence of breast reconstruction rates worldwide. In 2010, you can see that the breast reconstruction is the number 5 procedure done, with over 93,000 procedures performed in 2010 in America. In 2015, they note a 35% increase of breast reconstruction procedures since the year 2000. So what is breast reconstruction? To summarize, breast reconstruction really is a procedure to recreate a similar shape and form of the breast after mastectomy. And really it's about providing this option and choice to every single breast cancer patient. Some women decide to do a breast reconstruction after mastectomy. Some women decide to put in a breast padding in their bra after mastectomy. And some women decide to do nothing at all. Each of its options has its pros and cons. What's right for one may not be right for another woman. More importantly, you have the right to choose that. You may have seen some of these articles in the news, and there is an increasing awareness of and media exposure of breast reconstruction as part of breast cancer treatment. My ballpark estimates for breast cancer reconstruction would be that about less than 10% currently in Singapore. And as Jerry has mentioned just now, Angelina Jolie actually made headlines back in 2013 when after she underwent genetic testing, she actually had bilateral mastectomies or removed both her breasts. And following that, she did bilateral breast reconstruction. So that's how she looks as glamorous as she is right now. So looking at our local data, what really is the experience? This paper, which is actually just published earlier this year, actually shows the NUH experience. And over 10 years, they have about 900, close to 1,000 mastectomies, and their breast reconstruction rate is at about 24%. But what's interesting is that if you look at the graph, the light gray would represent the breast reconstruction rates. It's been increasing year on year, and we know that breast reconstruction is gaining more traction in the community. So you'll ask yourself, why do I actually need breast reconstruction? So firstly, on top of it restoring the shape and form of the breast, you actually would not need to wear any kind of padding and prostheses. You have a better appearance, especially if you like to wear swimwear or like to look at yourself in the mirror with lingerie. And lastly, and more importantly, it actually improves one's self-confidence and psychosocial well-being. And this does not just limit, breast reconstruction is not limited to just young women. Even patients who are slightly older, you can actually opt to do breast reconstruction. This study actually says breast reconstruction in the elderly, but they actually studied women who are more than 65 years old who underwent breast reconstruction after breast cancer surgery, and they showed better mental health scores compared to their compatriots who did not have breast reconstruction. And when they compare it with younger women, of course the younger women recover better physically, but mentally, these ladies actually fare better. So breast reconstruction has not just the effect on the body, but a good effect on the mind as well. So when you talk about breast reconstruction, what are your options? The options generally are divided into 2 broad categories. Firstly, will be autologous reconstruction, which is using your own tissue and skin. The second one being implant-based reconstruction, which is using implants. The timing of the surgery can be either immediate or delayed. In autologous reconstruction, we actually utilize your own skin and fat and or muscle from another region of the body and transfer it to the chest to recreate a new breast. So from the diagram, you can see that we usually use commonly the lower abdominal region right? And also maybe the back or even the buttocks or thigh regions. Okay? The most common procedure that we do is called the tram flap or the transverse rectus abdominis muscle flap, utilizing the lower abdominal skin, fat, as well as the muscle, and rotating it up to the chest to recreate a new breast mount. The advantages of autologous reconstruction is it looks and feels more natural, it's soft, there's no implant-related risk, and it's a permanent type of reconstruction. The disadvantages is that it's a bigger surgery, there are more surgical scars, you take slightly longer to recover in the hospital, and there may be a chance of donor site morbidity or muscle weakness. The other broad category would be implant reconstruction, and breast implants are utilized and placed under the chest wall to recreate a new breast shape. This is pretty similar to what is done for breast augmentation as well. So this implant reconstruction can be done either a 1 or 2 stage type reconstruction, and sometimes we use acellular dermal matrix or tissue matrix to cover the lower portion of the implant to provide more protection of the implant. So weighing the pros and cons, the advantage of doing implants is that you don't need to have additional cuts and scars on other parts of your body. There's no donor site morbidity and you recover slightly faster. The downside of that is that implant being an implant, it may not look or feel as natural as your own tissue. All right. There's also a foreign material or implant in your body, and when you leave a foreign material in your body, after some time there are some issues such as implant hardening, implant rupturing or bursting, and what we call implant-related lymphoma. Sometimes you may require more than one surgery to complete the reconstruction, and there are of course implant-related costs. So which option is suitable for me? Not me, but you as a breast cancer patient. Well, we'll take into account your preference. Of course, some patients prefer to have your own tissue. Some patients prefer to have implants. We would tailor this reconstruction plan according to your preferences, and not every option is suitable for every patient. What about the nipple and the areola? In general, if a mastectomy is done, the nipple is often removed at the same time, but we can utilize the skin around the nipple, around the reconstruction to recreate a new nipple. The limitations of breast reconstruction would vary according to the type of reconstruction done. In general, the sensation over the newly reconstructed breast will be slightly diminished compared to before surgery. Other possible problems would be related to the wound-related problems, scars, we require some revision surgeries to improve the shape, and the related autologous and implant type complications. At the end of the day, the choice is yours. It is important to find out as much as possible before making a decision. So prior to embarking on surgery, please have a consult and have a chat with at least your breast surgeon and or your plastic surgeon to find out more information. There are some resources on the internet, as everyone has phones and computers readily accessible. Please, I encourage you to go to these websites to look for either news media articles or even this website called bras.org.sg. Stands for Breast Reconstruction Awareness Singapore. All right, they are partner the Breast Cancer Society as well, and this website is created by plastic surgeons to raise awareness and give more knowledge to the general public. And with that, I'd like to thank you for your attention.
Thank you. Thank you, Dr. Peck. Thank you.